sister introduced her to my son Kyle. And when Kyle heard that, I needed hip surgery, his first thought was, well, introduce her to Lynn and find out a little bit more about what's all involved. And so he set me up to go visit her in the hospital the day after surgery. So that's how we met.
So here was the first week in June. I think my surgery was on a Wednesday, and about 5 o'clock on Thursday, Diana arrives in my place. She came, and she obviously was looking for some information about the procedure and had been to a couple other doctors.
You gave me so much peace of mind and just made me feel really good about going to visit Dr. Faure, and he put my mind at ease, and before I knew it, I was signed up for the surgery.
This was my second hip replacement, and my first hip had been done under the more traditional method where they involve a lot of cutting in the muscle, and the recovery period's much longer. So, I mean, I'm up, I'm walking. There's no hospital bed at my home. I'm walking up the stairs. There's no elevated toilet seat. I mean, it was like there was nothing to it.
Well, and that was a huge positive for me, because I had gone to other doctors who had said, well, we'll do the gold standard on you. Why would you want anything different than that? And when I heard, from Lynn and Dr. Faure about this great new procedure and the wonderful new table that Aurora Hospital has here at their new center, it was a done deal for me. I thought quicker recovery period, less cutting of the muscle or the tissue. I didn't think I could go wrong.
It was only, I think, 2 weeks that I couldn't drive, and I just basically was home for 3 weeks. And last day of June, I was back at work, physically back at work, which was amazing, because with the initial hip replacement that I had, I don't think I drove for 5 weeks.
Leading up to it, over a year. And so I was really ready to find a resolution and have something done that would give me my quality of life back. And this has really done it. I mean, I love to hike. I love to go on walks with my dogs, my family.
We talked about salsa dancing lessons.
Yeah,
we just haven't gotten to that
exactly.
yet. Well, in September, 3 months after the surgery, I went on a hiking trip in the Azores, where I hiked anywhere from 3 to 8 miles a day. So yeah, that, and I was right back to my yoga in September as well. And he said I could have gone back earlier.
I would say don't put it off, because it's just it's really, my experience in Lynn's was, it's nothing to be afraid of. The staff here is great. Dr. Faure just did a wonderful job. They're with you every step of the way. They put your mind at ease, and I think it was just one of the, if you have to have it done, it was one of the better experiences that I've had, medically speaking, because it really it went off without a hitch. It was great.
And the pain, or lack of pain, I should say, when you wake up and it's over, it's painful, but just for a couple days. But it's nowhere near the pain that you had constantly every time you placed your foot on the ground. I mean, there's nothing like bone on bone joint, and the people that need a replacement, they know what I'm talking about.
Exactly.
But you wake up, you're like, all right, I have a little pain, but nowhere near like the pain I had before. But if you qualify, oh boy, run, make it happen, get it over with.
I totally agree.